If you are experiencing foundation issues, get a free estimate from Ox Foundations.
3 minutes before the hour, and Sherry Glenn, the administrator of Coosa Valley Healthcare, joins us this morning. It is National Nursing Home Week, and we asked Sherry to join us a couple of days ago. Sherry, good morning to you.
Good morning.
Good to have you with us today. National Nursing Home Week, we'll talk about that shortly, but let's talk about Coosa Valley Healthcare. You've been the administrator there for several years now.
Yeah, going on 3 years.
And when did it become, it used to be Coosa Valley Nursing Home.
It did.
And changed hands, what, a couple of 3 years ago?
Yeah, it was in 2019. We were changed hands to Prime Management, which is located in Daybreak.
Okay, and they have nursing home down in East Alabama
They
as well.
do.
Yeah.
Mm-hmm. They do.
As the administrator of the nursing home, I guess the buck stops there, right?
It does.
Talk about the nursing home itself and what it has to offer.
Okay. We are an 85-bed nursing home. We offer skilled rehab, which is short-term stay through Medicare and different HMOs. A resident can come in from a hospital or home, and we can give them rehab. Hopefully they'll get better, get back on their feet, get back out into the home environment. We also have residents who live there. That's their home. Mm-hmm. That's what we call our long-term care residents.
Now, how many long-term care we have there?
We have around, I would say today, about 75.
Yeah, yeah. And I saw Bobby, help me with his last name. He worked at the hospital for a long time as an X-ray technician. I saw him over there the other day at the nursing home. Yes. It was good to see him. And, the nursing home itself, it is something in our community that, we don't like to think about nursing homes, really.
We don't.
But it is something that is necessary and has helped a lot of individuals and families alike.
It has. Like you said, it's something that we don't like to think about, but unfortunately we do need to start planning for that. And a lot of people think when you get to the nursing home, your life stops there. But that's not true. We've seen people that get better and can go home after a couple of years.
Well, that's good.
Yeah, they get into an environment where we can manage their medications, manage their needs, and they're able to progress and move on home. And of course, you have others that live there permanently, but we try to keep people active. We offer different types of activities through the day. Just keep them engaged.
My mom was a resident of that nursing home for many, many years, and she loved it, and you become like family there, really.
You do. We're one big family, and certainly I think it's a calling for people. Yeah. I've been there since 1997, so I think
what did you start out as?
I started out as a social worker.
Did you?
I did a little bit of social work. I did some activities. From there, I moved into what we call the assistant administrator, and went on and took my administrative license exam. Mm-hmm. Now I'm the administrator.
So how many employees are there,
We have around 97.
Okay. Mm-hmm. All right. Now, this nursing home, like nursing home in Alabama, there are guidelines and laws that are in place that are strictly enforced too.
We do. We are very heavily mandated by our state public health department, and also federal agencies like CMS, Medicare, Medicaid Services. We have what we call annual surveys, and we are probably right on up there with a nuclear power plant. As far as our regulations, there's probably about 500 regulations that we have to, adhere by. So.
And, those are for safety measures.
They are.
And
they are.
Health measure taking care of the patient. That is all good. Tell me a feel-good story about this nursing home. Maybe it was a client, maybe it was a long-term resident, or maybe it was a family member. During this COVID time, it's been a very difficult time for many people, including nursing homes, but there was some good to come out of that as well.
There have been some goods. Like you said, it's been a very trying time. When COVID first hit back in, I would say March, we had to go what we call into lockdown, which was very hard. I mean,
had you ever thought about anything like that before?
Never in my life. When you say lockdown, I think, oh goodness, but we could not let any of the public in. We couldn't let families in. So I would say around April, we came up with an idea that we would have a parade for our families. And this was probably the first time that some of the residents had actually seen their loved ones in person.
Oh my goodness.
So what we did, we lined them up in front of the nursing home. I would say at least 90% of our families participated. And we were able to, they drove past the nursing home in their cars, had them decorated real cute with signs. And just to see the tears of joy from not only the residents, but the families, given they couldn't touch, they couldn't hug, but just being able to see that person and know that they were okay.
And we just finished our second parade,
third
this past
yes,
Friday.
Our third.
So it was a success as well.
It was.
And
really
you wouldn't get on that horse, would you?
No, sir. Not a horse person.
Sherry Glenn, the administrator of Coosa Valley Healthcare, our guest this morning. What are some things that are going to be going on this week during National Nursing Home Week at the nursing home here?
This week is National Nursing Home Week. It kicked off Sunday, which was Mother's Day. That's usually the time that it's scheduled for. This is something that the American Healthcare Association promotes. All nursing homes participate in the state and around the country. The theme this year is Together Through the Seasons, and certainly we have had different seasons to hit us this past year. Some of the things that we're doing theme days. I think today is Western Day, so I got to go find my cowboy hat.
Yeah. You should rode the horse.
Exactly. There you Italian Day was one day, just different things. 70s, we're going to dress up in 70s attire, have a big cookout on Friday. So
you have a lot during the week of different entertainment and stuff that goes on in the nursing home. I don't know how that's been affected by the COVID. I know it's been curtailed some, I'm sure.
It has. In the beginning, we couldn't let any of our volunteers in. We're kind of loosening up on that a little bit now. If they have been vaccinated or consent to do a COVID test when they come into the facility, then we can let some volunteers in. We've had them actually to be creative and set up out on the porch, keep our residents inside and they can watch through the window, or keep them on the porch and let the people set up in the yard or whatever. So.
You know, Sherry, that's got to be hard for families to be able to see their loved ones and their loved ones see them, but they're not able to really interact with them like they normally would.
It really is. It's very, very stressful for them, very emotional for them.
At our nursing home here in Sylacauga, there are meals provided as well.
They are. They're provided by Coosa Valley Medical Center, our kitchen over in the hospital. Probably everybody knows that is Hickory Street Cafe.
It's good too.
It is good, and the meals that the residents get are just as good. So we have a lot of good meals for them.
Talk about the challenging time through COVID that the nursing staff faced.
It still is tough, and it's really tough. Not only are they stressed about their job, trying to keep our residents well, but their families. You know, you don't want to take things home to your family, you know, germs, disease, whatever. But, you know, it's a struggling time. We are still testing people. Based on our county percentages is how often we test. Right now, we're testing 2 times a week.
Wow.
Yeah. So all of our staff and any contractors that come in have to be tested twice a week.
Now, I've been tested for COVID. I've been tested twice.
It's not a pleasant test. It's not. It really isn't. But after 2 times a week, you just kind of get used to it.
I guess so.
And I know that it sounds extreme, but that's for the protection of our residents and our staff.
Now, are the COVID-19 vaccinations, have that been going on in there too? Or?
We started a few months ago, and I would say at least 90% of our residents are vaccinated. Have a few staff, a lot of our staff are hesitant, especially your younger ones, which is, you know, and we do not force anybody to have the vaccine. That's strictly their choice. But we are offering some incentives for staff if they choose to get the vaccine. We offer clinics there in the nursing home. We encourage them to use local clinics such as the hospital or wherever. So.
Now, churches have always played a key role in nursing homes, and I know that's been a challenge as well with COVID.
It has. Like I said, we've had to stop a lot of our volunteer churches and people from coming in, but we're trying to get creative and have them set up so that we can socially distance maybe outside and do some things. So.
Like everything else, the cost of care goes up every year. Do we have openings at the nursing home now for clients?
We do. We're not running at full capacity. We're almost there, but it has hit. And I think a lot of it was people were hesitant to put their loved ones there because they couldn't come in and see them. That would be hard to drop your mom or dad or grandmother off and not be able to see them after they go through the door.
And I saw this when my mom was there, and I've seen it since. There's some residents there who you guys are their family.
That's true.
They don't have anybody else.
They don't.
And that's a sad thing as well. But Tara Patterson.
Yes.
That works with you guys. Man, she is a gem, isn't she?
She is. Tara's been with us for, I would say, about 5 years, maybe a little bit longer. She's a CNA, a certified nursing assistant. That's what she's done for a long time. And I would say about 2 years ago, she went into the activity role, and she has really shined in that role.
And she helped put together the parade and all that kind of stuff. And so I want to say good morning to her as well this morning. We're talking with Sherry Glenn, administrator of Coosa Valley Healthcare here in Sylacauga. As administrator, what drives you? You're going into a nursing home, and it's not. It wouldn't be my highlight of the day to go into a nursing home because I'm not accustomed to that.
Right.
I'm not saying anything against or anything like that, but what keeps you going?
Our residents and our families. The way, like I said, most of them are there to live out their days. And I think any type of happiness or joy that we can give to them, especially in this trying time, then that is very rewarding for me.
It is National Nursing Home Week, and we're a part of that at Coosa Valley Healthcare. Sherry Glenn, the administrator there, we appreciate her coming by this morning. Now, what is the process for someone to become a resident of the nursing home? How does that work?
Well, it starts with your doctor. They would make a recommendation that you would need rehab or long-term care. From there, you would get in touch with our admission coordinator, who's Candace Williams. You can do that by calling the facility. And from there, we will get with your doctor, get health records, medical records, and go through the process to make sure that you qualify.
So a person just can't say, hey, I just want to spend the rest of my days in Coosa Valley Healthcare.
It's a process, not only from a health standpoint you have to qualify, but from a financial standpoint as well. So.
We've seen stories nationwide about security in nursing home. I know that's so important with you guys too.
It is. Security is very important.
You have to keep doors locked, and
we are what we call a locked facility, which is for the safety of our residents and our employees, because you can't just let anybody in the facility, and we can't let people out of the facility, especially with your dementia patients who are who don't know where they're going, they wander, and that's for their safety.
I guess one thing about a nursing home for the employees and those who care for those residents, you got to have a lot of patience.
You do. You really do. We have a lot of family members that apologize and, oh, I'm so sorry that Mother's this way. It's just another, it's fine. Yeah, so
if people watching this morning want to visit a relative or a friend that's in the nursing home this week, can they do that?
They can. We are doing visits. We encourage outdoor visits on the porch, but they just need to call the facility and get a time scheduled. And we do have accommodations that we can let you inside the facility if need be. We just can't let people, what I call, walk freely through the building. We can't visit in rooms, but we have some common places that we can visit. If there
are people watching this morning that would like to volunteer for whatever they can do at the nursing home, how do they go about doing that?
They would need to call the facility and speak to Miss Tara.
Okay.
Tara Patterson.
Okay, all right, sounds good. Sherry Glenn, the administrator of Coosa Valley Healthcare here in Sylacauga. It's National Nursing Home Week, and Sherry, thanks so much. I know it's a busy time for you.
Thank you.
And she texted me last night, and I don't know, 5:30 or 6 o'clock. I noticed about 1 o'clock this morning. I texted her back. She was sitting by the bedside waiting on that.
I was.
Yeah, Sherry, thanks so much for coming today.
Thank you for having me.
Godspeed to you and all our friends and residents at Coosa Valley Healthcare here in Silicon. More Daybreak just ahead. Don't go away.